it'd be nice to at least make sure that person knows it's now. Say, that one, I got to get that.
Hey, good morning, everybody. We are so glad to have you here with us this morning, and we have a full agenda. I don't know if I really want to call it agenda, but we have a full list of items and topics that need to be addressed. And we have a guest here with us, the Honorable Temple Jewett. But before we start, let's say the pledge. Mr. Walsh, will you lead us?
Let's pledge.
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
So with that said, we are going to start our work session this morning with an update from our Lytle's Fork Recreation Area Advisory Board Chair, Temple Jewett. And Temple, we appreciate the work you all are doing and the time and effort. So you're here, and we also have another member of the advisory board, the Honorable J.R. Brandenburg's with us.
The Godfather
of Scott County. Now I'll turn it over to you.
All right, thank you, Judge, and I'll be quick. Three things just to update you all on. I don't know, any chance, are there copies of this?
Not yet.
Okay.
We'll share them electronically after this.
Okay, that sounds good.
Just to show that y'all are working on on a logo, so to speak.
One thing that has happened is there was a letter that went out, timing on a lot of this stuff is tricky because we meet and then it's usually after your work session and all of this. So I probably should have gotten this to you earlier, and I apologize that I haven't.
No worries.
But it's a very positive message, just telling, and it was sent only to the landowners around the property, and just to say, hey, we're doing this. If you got any ideas or suggestions, come. The idea obviously is to engage and make sure that everybody has an idea at least what's happening, and nobody's surprised at the 11th hour if there's anything that we want to do. So that did happen, and I have copies, or I don't have them with me, but I can get you copies of that if you want. The other thing is,
I will say that the focus of that letter, was, we want to expand opportunities for horseback riding, trail hiking, bicycling, mountain biking, and other opportunities out there, and
absolutely,
and that was the message. And how can we improve the experience in an incremental way? And I thought the spirit of the letter was appropriate, and hopefully we'll get some feedback from folks.
Yeah, I appreciate that, and we, one of the great things you did in establishing the committee was put Lori on there, and we ran this through Lori. And she's got the marketing focus and all, just knowing how to put the right language about what we're trying to do. And I think it was really good about describing to everybody, and like you say, just emphasizing the positive of all this. So
and they've already got this letter.
Yeah, it's already gone out,
and it's probably 20 people. Maybe, yeah. It was either contiguous or maybe like a half mile to a mile radius around. Was it an arbitrary? December 4th is when it was mailed. Yeah. So.
And I've not received any calls. I think Magistrate Wallace, you had one individual, from the Beagle Club, ask.
Yeah, and they were just confused of where, what was going on, who was managing, and does the county have involvement? And so I answered all those questions, but Judge and I talked about it, and people don't always read everything and
Yeah.
understand what they're, what the implementation of the things that are said in the letter. So I explained to them that, hey, everything still has to run through the county, and this is just some folks that are looking for ideas to improve the reservoir area.
And honestly, Chad, that is exactly why we wanted to do this. So if you've got those kinds of responses, let's get them out now before we get down the road. Mm-hmm. And so actually, I'm glad that those people now feel at least that they understand what's going on.
I had the same call from a guy I know that runs beagles for rabbit hunting. He just wants to run beagles, not to hunt out there. And I worked with Jared and Animal Control and let him know that he could. So I don't know, maybe if there's something that you all could put out that says, here's what is and isn't allowed, so people know.
Well,
is and isn't allowed?
Yes.
Well, I'm glad you said that.
So what a segue.
Me too. Meeting just got long.
Nice transition there, Ryan. Actually, not longer, was part of the presentation. Were you going to say something, Judge?
No, the segue to proposal from the advisory board about just general guidelines / rules of the property. So.
And these are taken, if you all know, we have Michael Johnson is on the committee. Michael works with the Fayette County Parks Group, and his part of his job involves Ravens Run management. And so we're kind of looking, not exactly necessarily, but we're looking at Ravens Run as kind of a model for what we're looking at here. So we wanted to put in place some rules. Now, understanding that, again, this is the long game. Enforcement is going to be an ongoing project, okay? That's going to be a work in progress. But I think we need to instill the tools that if we need to take care of a problem down there, we need people to understand what the rules are. And so that was one of our short-term goals, was to get some rules in place. And I'll send these to you. But basically the idea is just, dawn to dusk, no camping, no alcohol, no open fires, pets on leash, trash and debris take with you, no collecting. We didn't want people coming down there and taking things out of the property. I mean, we want to foster what's down there. For mountain bikers, not allowed on horse trails because of the problem there. And the bikers are part of this, so they're fine with that. Stay on the bike trails. When encountering a trail rider, ensure the rider sees you. Trail riders, horses, not allowed on the mountain bike trails. And if your horse is not accustomed to bikers, don't go there. Don't go on the trails that intersect. And then for hikers, they're allowed on all trails. Be aware of the bikers and the trail riders. Ensure that they see you when you're encountering a horse and that sort of thing. On bow hunters, we are proposing that stay with you, with Judge, in terms of permission to do that. We still feel like on bow hunters, just leaving it wide open with no sense of permission or anything like that might cause us a little bit of congestion down there. So we wanted to at least put something for now on that. There may be another method that works better, but for now we thought that's fine.
I just followed what Judge Lusby had done for years. They simply come in and they give their name, say, I'd like to bow hunt. We give them essentially a little stamped card. And
I'd make a suggestion, if it ever gets real big, maybe do a lottery type, just so it's fair.
And that
I like that.
That would be a real consideration.
And watch the seasons too, because bow season starts early. You have a lot of horse riding out there at that time when bow season really gets started.
Yeah.
So,
but
if we do promote it and it starts getting big, you really need
Verify addresses of people.
they show a ID.
Keep it local as much as we could.
Yeah.
Yeah, that's a great idea too, Dwayne.
But no, to this point, JR, you can speak to it, and I don't get calls of complaints of, we've been lucky, but if it expands, then you have to be aware of, what can you do to protect both groups,
Yep.
and not, still have the opportunities for both groups.
And
Exactly.
and the group is anticipating expansion, but I think at the same time, we want to take sort of a wait and see attitude. So no, not a lot of drastic changes up front. Let's see how it goes, and then we can adjust as we go along, is the idea. And then no hunting on established use trails. Tree stands and blinds have to be removed at the end of the season because apparently some get left down there. And then blinds and tree stands 150 feet away from any trail. And so we think that's happening now anyway. But this will just give us the infrastructure I think we need for when we can figure out exactly how the enforcement and the security of the area is going to be handled. We haven't had a chance to even talk to Tony about possibilities in that arena, but that might be the first place to go. But this will just give us what we need to enforce if we do need to enforce something.
Did you guys talk about motorized vehicles?
Yes, one of them, I'm surprised I must have skipped over that one, Kelly. No unauthorized motor vehicles. So we wanted to at least leave it open. Obviously, there might be an event where you've got people in golf carts down there or side by sides just monitoring an event or something like that. Cleanup, maintenance, some JR's stuff. So we just wanted to say, but you have to be authorized to have a motor vehicle down there. And that came into play, there was a discussion about what about motorized bicycles, because there's such thing now. And the biking community kind of has that under control, the Kimba group. And I think there's a certain level. It's kind of like mopeds, like up to a certain cc. It's this.
Really bike trail riding, if you're not.
Well, what they were sensitive to is the guy who apparently was one of the founders of Kimba is now not physically able without the assistance. So they were distinguishing between motorized bikes and basically pedal assistance, or I don't ride, so I don't know. But there's a distinction, and that's the kind of thing we're trying to get at. So it's a bit of a balance. But so those rules we would like to propose as a starting point, and obviously that'll be a working document all the time. I'm sure we'll encounter things along the way and want to add or maybe take away or change someplace.
And as we go forward and finalize that list, spending money on signage that you put in multiple places near entrances and well-traveled trails, and then putting it on website and then sharing it with just local groups.
I do have a question to go back to kind of what Chad and I were talking about with the beagle, because it said the animals on leash only. But when I worked with Jared in animal control, the current ordinance says that if you're training dogs for hunting or training, that your animals can be off leash. So could they be off leash for that, like if they're running beagles out there, or no? Because that's what we told this guy with Jared in animal control. They were like, yes, that's the purpose of this ordinance, and that's what this land should be used for. So, and that's what we told him.
To be honest, Ryan, we haven't really gotten that far in the weeds on it. That's a good consideration, and I will take that back and let us kind of think through that and come up with a solution for that. Okay. I don't think we really thought about hunting dogs.
Yeah, I'm fine with whatever. I just want to be able to tell this guy, I don't want him going out there because we told him he could.
Sure.
And, getting in trouble and saying,
Absolutely.
Yeah, Ryan said so. But animal control and really us, we said so. So.
Yeah.
That's okay.
Yeah.
I'm taking everybody.
Just got one question.
Rob Jones.
Tim,
Yeah, Rob.
Is the boundary of the reservoir property, is it marked in any way?
I don't know the answer to that. Is it marked?
In any way, like the trees marked?
It's got fencing all the way around the boundaries of it. Yes.
Okay.
But do we have signage I wouldn't say there is signage.
I just don't want to start promoting and people start going on other.
It might be
you know,
something that
private property and stuff.
that we hang signs, boundary signs or
I
something.
know, like at Kleber and the wildlife areas,
Yeah.
they paint yellow around the trees
Yeah.
so you know where the boundary is.
Did you all do that on purpose? Y'all are just like segueing right into my next point. I feel like this has been rehearsed. This is something that, talking about signage, traffic is starting to pick up out there. And on the weekends, I'm getting reports from people that live down there that you're seeing, 100 people down there. And that the parking lots are full. And I was down there one day, and the parking lot over there by the church was completely full. And so starting to get some of these things posted, even if we're not starting improvements and so forth, might be a good idea. Like you're talking about marking the outer boundaries. And Kimba's done a pretty good job on the bike trails. I think the horse trails probably need more in terms of the signage and communication and wayfinding and that kind of thing. So it might be good to start thinking about that. I want to give Lori a lot of credit. Her team has done a great job with this, I think. And I'm sorry I don't have copies for you, but I'll hold them up here.
We'll share that electronically.
Okay. We wanted a logo. And I don't know if you've done Sheltowee Trace. They've got that turtle. And they'll just paint that on a tree, and that's the symbol, right? That you're on the trail, and it's a Sheltowee Trace, and that sort of thing. We wanted something kind of like that, and so they came up with this, which I think is really, obviously this would be basically, if there was a Sheltowee Trace turtle for us, it would probably be this, assuming you all agree with all of this, of course. It would be this. But then it mentions hike, bike, ride, Lytle's Fort, and then down here you can see some one-offs to where if you're marketing to a particular community, you can just isolate either hike, bike, ride, that sort of thing. So it's kind of like a marketing plan as well. And then, on signs, this was some of the stuff that we saw that you had seen before, and we kind of combined that with it. These would be sort of the taller, smaller signs. These might be the larger signs, and those were the things that we were actually looking at possibly putting together. But this has actually been voted on by the committee as what we'd like to recommend. Obviously, if there's any concerns or questions or desires to change anything, we'd love to hear it and take it back and
No, I'll definitely share that and then get some feedback from the court. But like you all are doing, I think exactly what we need done, and it's input from the community and stakeholders and moving it forward for a permanent outdoor recreation area that's promoted more and a place that our community can enjoy. So yeah. I'm excited about it, and I'd like your all's feedback, your and JR's. Like one of the things that the low hanging fruit is, what can you improve that won't cost a lot but will make it more inviting, and putting gravel on that area that's adjacent to the church, and just pretty much gravel in that whole area this spring, I think would be something for the court to consider. Would you all agree?
Absolutely.
And just having stuff on their mind about, okay, let's check this box. And then the other item is you've looked at places to possibly go on Gaines Road and have a trailer pull off.
And I am negotiating with the property owner on the first one that I need to do right now. So.
Well, we're in good hands with the Godfather negotiating.
And one thing, this is probably a temple, but on the enforcement of these rules,
Yeah.
Captain Benson here would be gladly come president.
Because I live on Game too.
Well, I was going to say, like, you're wearing two hats because you live there, and
Yes.
Some of the issues you all talked about, we have had calls in the past with horse riders and bow hunters kind of meeting and having issues, or multiple bow hunters trying to use the same stand. So we've had complaints with that kind of thing. I know I see raccoon hunters out at night all the time, so I don't know if you had hourly restrictions either.
Well,
that kind of thing.
dawn to dusk was the idea, and that we would just, go with that. But we'd love to have you at the next meeting, which will be the fourth Thursday of this month. Yeah,
fantastic.
great.
Any other questions, comments?
Temple, one thing is we're thinking about where we might go, and Rick has mentioned motorized vehicles out there before.
Yeah,
As far as the insurance, I'm going to have you put a different hat on.
yeah.
What will trigger insurance and increase in liability? My guess is if you let ATVs and UTVs,
Yeah.
your liability is getting ready to be increased for the county. Is there anything else? I mean, obviously guns. Is there anything else that can trigger, increase in premiums and liability?
Just where we're not covered would be ATVs. That's not covered at all. Now, you've got the recreational use statute that comes into play if you're not charging anybody anything. And that's why we didn't go toward any kind of permitting or anything like that, because then you get into much more liability issues. But the recreational use statute is an immunity, and the courts are always trying to cut into that. So I think anything, and just think risk, I mean, you've already highlighted probably the two most important would be the motor vehicles and the guns. That's not to say guns will, that's not, you're not going to lose coverage for that. I mean, we have ranges and so forth that we insure and that sort of thing. Most of that stuff is done in a pretty controlled environment. Certainly, that's something that we would keep an eye on as the I'm speaking as the insurance company.
Yeah.
And we would keep an eye on it. If the experience is clean, then it's probably not going to hurt you a whole lot. If we see the experience ratcheting up, somebody gets shot, somehow
Play pigeons
dogs,
something like that.
then that's certainly going to affect it for sure. So
Does
does
that
that
answer-
answer your question?
Yes, sir.
Okay.
Anything else? Temple, thank you. I know you got to go to your day job.
Hey, no problem.
But
I
we appreciate you.
Yeah, thank you all.
Thanks, JR, and thanks for volunteering to go help. We'll move over here now. Jella Broyles has joined us, and I shared some of the information about both bids, and shared some specifics, and just want to hear from you about what your recommendation is, and then open the floor up for questions and go from there.
Yeah, sure, Judge. So the medical provider down at the jail obviously fulfills an extremely important role for us down there. Currently, and for about the past decade, it's been SHP, which is Southern Health Partners. And we've had really a good relationship with them, and they've done us, in my opinion, since I've been the jailer, I think they've done us a good job. The medical provider provides for all of the health needs of the inmates, but they also assist us with emergency medical situations down there. If we have an overdose situation, hopefully the nurses on staff to assist us with that until EMS can get on the scene, or a heart attack or a stroke. So they help with those emergency medical needs that we have down there as well. But finally, they also help us with the determination of some of the new intakes that come into the jail. We can refuse, on a rare circumstance, we can refuse to take an arrestee off the street if we feel, and if the nurse is there, they make the determination that we can't provide for this person the medical needs of this person. They can be refused until they're evaluated at the hospital or cleared at the hospital. So really the medical provider for us is an extremely important role. SHP has fulfilled this for us for the past 12, maybe 13 years. done a good job, but the contract has, the agreement has not been redone in several years. And there are several things that I really felt like we needed to look at changing with that contract. So, felt like it needed to be rebid. So, we came up with the specs for the proposals. I had Cam look at them, I had the judge look at them, and got input from both of them. I chose a couple of providers, one being the current provider that we have, SHP. Another provider that I have gotten positive feedback from other jailers on is 3Cs, and they're out of Western Kentucky. So sent the proposal to each of these companies and with the specs, and they got us proposals back. The proposals came in, and for the most part, they were able to meet all of our specs. I'll tell you, SHP met all of our specs completely that we were requesting, which was great. 3Cs didn't quite meet them on a couple of very minor points, but SHP met them all. When we looked at the pricing, SHP was substantially less than what 3Cs was. So we've got a history, a continuity with SHP, a lesser price with SHP. SHP is meeting all of the specs that we requested, and so my recommendation is to go with SHP. And it was a substantial difference. It's an annual savings, or at least an annual difference in cost between the two companies of about $77,000, $78,000 for the county. So my recommendation is to stay with SHP. If you like, I can explain a couple of the changes, how the contract is improved for the county or improved for the jail, which obviously improves the safety of the jail. If you like, I can mention some of those, or if not, I can just open it up for questions.
I shared kind of the basics, that pictorial table. I
Yes.
shared that, and are there any questions specific about any of those items?
I have a question.
Ryan Pratt.
What's the cost pool? It says $60,000 cost pool refunded if unused. Like, I don't under, like, with all the stuff that's in here, I just don't, what's the cost pool for?
So there's certain things are covered by the contract, and then certain things are not covered by the contract, and they tend to be more of the anomalies, more of the unusual occurrences. If we have to get an x-ray on an inmate, well, we can do that at the jail. What SHP does is they call in a mobile x-ray company to come in and do an x-ray. Obviously, anytime we take an inmate outside of the confines of the jail, it's a risk to the inmate, a risk for staff, maybe a risk to the public. So everything that we can do at the jail, we do at the jail. And so what SHP does for x-rays, they have mobile x-ray come in. That is something that is not included in our contract price. So we have a cost pool, a chunk of money set aside that pays for these extra things. If we have somebody come in with kind of catastrophic medical circumstances, say they have AIDS, or a specific kind of cancer that they need treatment for, some of those are not covered by our current contract and can be extremely expensive. So again, we have this cost pool, which is a chunk of money set aside for these kind of extraordinary costs throughout the year.
That makes sense. I just didn't know what it was for.
And I'll tell you, one of the benefits, two things with our current with the proposal, Mr. Pratt, is that the cost pool has been increased. So that's part of the reason for the overall increase of the contract. The difference between this year's contract and the contract that we'd like to go to, that I'd like for you guys to consider and approve, the difference in price is about $75,000. And so the increase in price, part of that is an increased cost pool. It goes from $45,000 to $60,000 because every year we're going out of the cost pool. We're expending the cost pool. But another plus is if we don't expend all of the money in the cost pool, which is more of a rarity, the contract we had with SHP before said if there's any money left at the end of the year, we're going to refund only 80% of that back to Scott County. Well, I changed it to where one of the specs was you have to refund 100% of that back to the county. And again, they were agreeable to that, and so that's just a couple of sidebar notes on the
increase
cost.
of 15,000 on the pool part.
Yes.
And then another 60,000.
Well,
is the increase.
It's really not that much. I asked Karen to run 22-23, and we spent 261,055. So their proposal's 319.
Right.
So, and we spent about 120 to date for this fiscal July through December. So,
Still running right.
I mean, we're running pretty close, but to get 12 hours a day is
That's a big deal.
there's a big value in that, and especially for your staff.
Yes.
I mean, because it takes that pressure off.
It does.
Of your staff. You feel the same thing?
The two biggest pluses with this new proposal are, and again, this enhances the safety for the inmates, safety for the staff, and I would think liability for the county to a certain degree, is that we're going from medical coverage, which is having a nurse at the jail, 10 hours a day through the week and 8 hours a day on the weekends, to 12 hours a day. And so that's a substantial increase for us. The other great aspect for us is that we stipulated in the specs that we want their coverage to start at a certain time. Because what's happening right now is with the say 8 hours through the week, well, they'll come in at 7, 8 o'clock, leave at 4 or 5 o'clock. So day shift has them, but night shift doesn't have them at all. Doesn't even have a conversation with them as far as, hey, I've got something going on with this inmate. Can't even have a quick conversation with them. So one of the specs that I put into here was, because our shifts run 7A to 7P, 7P to 7A, is that your medical staff will start at least by 0500. So that gives our staff, night shift specifically, at least a little bit of face time with the medical staff. And so that's a big plus for us, in addition to the expanded shifts that we're gonna have down there.
The only other item, and I shared this with the court, was where I'd spoken with Paula Holden
Yes.
about the drug formulary list.
Yes.
And doing just a comparison, and she says she does this all the time with other jails, that we would compare like what the price we get for our employees to what they're paying, and that wouldn't impact the contract at all. It'd just be a savings.
Yeah.
So I'm going to try to work on that and circle back to that. And the other item is the recommendation from you is to start this July 1, and I feel like the same, because it's, we didn't budget for the difference.
Right.
So you'd be voting to approve the proposed contract effective July 1, and we could budget that difference into the budget for next year.
As opposed to messing with the budget.
Yeah.
In any way this year. Yes.
Jay Boyles, as far as your drugs, like your over-the-counter medications, I believe one time you had, I think J&L Pharmacy was your own provider. When's the last time you bid that out?
So that's part of this contract.
Okay.
Yes. So, and that's part of what the judge just touched on, actually, is SHP gets their own pharmaceuticals, their own medications.
They administer it all.
That's right. And because they're a multi-state corporation, they get a really discounted rate, which I think is really, I think a great idea that the judge has with comparing their pricing, if they can get it, for county employees here, because I would think that they would at least be comparable, if not a better deal for the county.
And one of the things is, like they get, like if somebody requires medication, SHP like bundles it in smaller bundles, where like if somebody leaves and they have 10 days left of like they bundle, according to Paula, they try to be strategic about how much they right instead of giving you 30 days and charging you for 30 days, they give it like in different smaller increments. So,
and I will add that after the proposals came in, again, the county attorney looked at them, reviewed them, and we had a short discussion about them. So,
any other questions?
And this, I was just going to say, this is just due diligence on your part. You didn't have any issues with Southern Health or anything. Okay.
Correct. Yep.
You may have said this, but how much of a difference is it in your budget? Like what you pay now monthly?
So monthly, I don't have that off the top of my head.
I've got the monthly,
but the annual is the judge said about 60,000.
So
I mean, is it really, because it's such a benefit. I mean,
Huge.
instead of waiting till July, I don't know if we go ahead and start it sooner.
well, so the monthly price, like what they're saying in this agreement, is we would pay them $26,624 a month.
I saw it, yeah.
And what Karen has, like just giving you an idea, like, and I'm sure because drugs or X-rays or stuff comes in, that's why it goes up and down some. But like July of 22, 23, we paid $31,000. August we paid $18,000. September $23,000. October $23,000. And then to this year, in July of this year, 23,000. August 28,000. September 21,000. December we only paid 8,800, but I think that's probably just a partial billing. Probably.
Yeah, I believe so. Yes,
it
sir.
wouldn't be that much difference. So to answer your question, they're going to want 26,000 monthly. I've read, you can see there's some difference, but that's the pleasure of the court.
I kind of agree with you a little bit, because we're looking at retention of staff too. If this helps staff down there, it's not really that much more money. If it improves the environment for our staff in the next 6 months.
So I can tell you that actually is a really great point. It absolutely will. It takes a considerable amount of pressure off of the staff, and that's not just
especially that later period, right? That doesn't
absolutely
usually have time to talk to the doctors about what's going on, or not doctors, but whoever.
Yes. Yeah. Absolutely. Yes.
I got one more question. So it says we're going to pay $26,624 monthly, but that includes the $60,000. So for that amount, it would include the cost pool. So how would that work? Like if we pay that out, do they reimburse us at the end of the year? Like if we don't use it, because the monthly price includes the cost pool. Like should the monthly price not be the? So they're just going to pay it back?
Yes.
Like,
yes.
Why wouldn't we? I'm just asking. Why wouldn't we pay like?
Set an escrow aside.
Yeah, like why wouldn't we pay the
kind of what you're doing.
$259,488, pay that monthly, and then keep the $60,000 ourselves and pay it out as needed? Is there a benefit to that?
So I would be okay with that. This is the way SHP has it set up with their facilities that they service, and it is kind of like an escrow account. They are taking that money every month, and some of it's getting used more one month as opposed to other months, and then at the end of the fiscal year, we actually have it's a 30 or 60-day clause at the end of the year to go into the next fiscal year to account for getting the bills in for the last month of the fiscal year, the last month of the fiscal year to be paid out of that cost pool from the previous fiscal year. So, but yeah, ultimately it's refunded back to the county in their 80% of it right now is what they're refunding back to us.
But you're really, you've got to assume probably not going to get any money back.
Correct.
We're typically going.
We've been exceeding.
We've been exceeding 45.
Yes.
Probably in that 60 range anyway.
Yes.
I would bet.
The one negative thing, very minor thing that that it was changed with the agreement was because we've been with SHP for quite a while, they have an average daily population that they base our rates on. And so obviously if their nurse is coming down to our jail and she's seen 86, she has 86 inmates to deal with, if that population goes above that, she has to do more work because she'll have more sick calls. And so they charge us a per diem rate once we go above that average daily population. That had not been adjusted in years. And so we adjusted that up to, it was 110 or 115. And the savings for the county is that when we go over that ADP, which they had just as our capacity, 86, and of course we're always above that, so we're constantly getting this per diem charge from SHP. We'll have less of those today because 110, 115 is a lot closer to where we hit. Now we go above that, but we also drop below that. It's a lot closer, so we won't be paying SHP as much of that per diem that we've been paying in the past. So that's the...
You raise the bar.
Raise the bar just, a little bit, by about 20 or so.
Like you're talking about numbers, like December 18th, we were at 101. Mm-hmm. Here this week, like Tuesday, 119, Wednesday, 126, yesterday, 127.
Right.
It just spikes up a little bit. You know what we are today?
129.
129.
But we do have court tomorrow. So we've got some quotas that have come in. That's
court Monday.
I'm sorry, Monday. Today, I'm sorry. We've got court today, so we've got some, and we have court Monday as well.
Okay.
So the 129 number that we have today are some of those codas that come in temporarily to go in front of the judge, and then they get sent back.
What's
So,
that acronym stand for?
Court order to appear.
Okay.
Yes.
Mrs. Court.
Right. So-
Just on the topic of thinking about how the numbers work, one of the things that I think might be better, just for me, for the budgeting purposes, is that we look at things from a yearly basis, and I'm sure Darren knows that the overall budget this year for these programs was somewhere around $400,000. But there are things that fluctuate that instead of looking at a monthly basis, we got to look at it from a yearly or a fiscal year basis. And so, for example, like on your budget this year for out of inmates spending out of county, you know where you're at with that?
We're above where we budgeted. Matter of fact, we're already above where we budgeted.
So where we are, we're 6 months left, and we're above that budget line for that. Now, I'm not, Darren does a good job of making it all in where we don't go above budget.
Right.
You work it out where you take from one place to
Yes.
That's why for me, it's kind of better to look at this proposal on
Look at what we spent
from the whole
and base
year
it on that.
versus looking at it.
as opposed to saying, well, the contract is this and inserting that number in there.
But I would just like to say, and I know we've talked about this before, I do traditionally turn back. I do not expend my budget and ask for extra money. I traditionally try to run a tight ship and try to give you guys back what has historically been $200,000 to $300,000 a year out of the budget.
I think it's a no-brainer with who you go with. I think it's not a win.
No, I think that's the only question. And if that's the pleasure of the court, then certainly we would entertain that. Jello Broils, one additional thing that I talked with Brian Privet this week, just getting an update, and this is kind of tied to medical and everything. You know, Brian Privet with Isaiah House, I said, I just wanted to update, like, where are we at, what kind of numbers we have. They have 30 full-time clients. These are new clients at the Isaiah House that they're working with from Scott County. 13 are direct referrals from the jail, and he reports procedures are working with the jail in place, and staff are going to the jail multiple days per week, and he thinks that that's only going to increase probably those numbers. So I appreciate that very much. I think that's we're collaborating. We're trying to get people that need that type of help, the help they need, and the work. They also share that there's 5 referrals from drug court, and to me, that number is it's 30 people that are getting help that wouldn't get help if we didn't have these things in place. And then the collaboration with you all and the jail, I appreciate that very much, and I think that's a very positive thing. So I wanted to report that. And Southern Health Partners can probably help. I know that staff from the Isaiah House comes and does the assessment. You provide the space for them, but if somebody's noticeably having issues, then that's going to be another help from this medical provider to help coordinate with another program.
Yes.
So.
Yeah. And I also talked to Southern Health about the mental health screenings and kind of ironed out a little bit stronger mental health screening that they do when they first meet with individuals, which is going to be positive as well. In regards to the Isaiah House, and I appreciate you saying that, Judge, I touched base with, I forget her role down there, Alicia McGee. Is she the director? Or
I think she's the site coordinator.
Yeah, so just to make sure things are going as they should be going, I touch base with her also, or have been touching base with her, because sometimes you put something out there, this is the way we're going to do things, and it doesn't get followed through with exactly how I'd like to see it get followed through with. But I did touch base with her most recently, maybe a few weeks ago, and she said everything's working well. I asked her if there's anything we could change or improve to make it smoother, make it a better process. She didn't have any suggestions, so just want to let you know I was reaching out to Isaiah House as well. No. But I appreciate you saying that.
No, thank you.
Yep.
Can I, this is to do with jails, but kind of off topic of what we've been talking about with Southern Health Partners and all that. But with the legislature back in, over the last year, there was a jail task force committee and stuff. And I would recommend that all of you up here keep an eye on that and look at the CAECO updates as they come out about legislation, because I think the state is of the mindset of, well, if you all can't come to a conclusion, we'll take it over. I don't want the state to take it over. It doesn't get cheaper when the state takes it over. So I have zero support in any kind of situation or option like that the state takes over. So I know that in the Jailers Association, you all have been talking about it a lot, but keep an eye on that, because if we lose control of what happens locally, a lot of people say, well, but then we're not paying for it. Oh, you're going to pay. It's just a matter of how much do you pay. And we have better control with the jailer and with the court keeping it local as opposed to letting the state take over. And then at that point, it just determines how are state inmates handled. That's the situation, is how are state inmates handled and how are they paid for on a daily basis back to the local counties.
Well, I appreciate you saying that, David. And if you don't mind me adding, I could not agree more. Local control is really where it's at as far as being responsive to how we want things run at the jail or wherever, the road department, the sheriff's office. Keeping it local is the best way and the most efficient way. I would tell you, without casting any stones, DOC doesn't effectively take care of what they already have in their basket to take care of anyway. And one of those things is the state inmates not being classified very quickly. They're supposed to be classified within 90 days, and they're taking 6 months. I mean, we had a lawsuit a year or two ago in northern Kentucky, an inmate suing because 12 months and he hadn't been classified. And from the state's perspective, they're getting a deal by housing that state inmate in a local jail instead of in a state prison. It's more expensive to house in a state prison. But if the state takes it over, I think that a poorer job will be done, especially when you're looking to have a specific response to a specific issue in a specific county. Good luck, I think, getting that situation resolved. And David's exactly right. We'll end up paying, all of us, because we're all citizens of the county, we'll end up paying with state tax dollars going towards an inefficient, ineffective incarceration system run by the state.
Wasn't there a lawsuit by a jailer or the Jailers Association against the state about the 90 days and that they're taking so long? Do you know where that's at, or if it's still going?
I don't know. Maybe David.
I don't.
Yeah.
I know that there was one filed. I just don't know where it's at.
I haven't heard that date on that.
I wasn't involved in that, and I'm still not involved in that. I'm not on the. Yeah.
Because we have a conference call.
Yeah.
Yeah, I think that's a totally different lawsuit.
It is.
No, I know it's different. I think it was something about the Jailers Association.
It was. Yes. Yeah.
Thank you very much.
Yeah, appreciate
And
y'all.
I think the only question is, what's the pleasure of the court? Do you want to look at numbers and look at going ahead and asking to put this in place sooner than July 1, or do you want July 1? And then
I would suggest the administrative groups who have to pull that off.
the other question is can Southern Health Partners, would they have to adjust staffing? Like have to be some time in there for them to have staffing in place.
Yes. So if we wanted to go immediately, which if it were up to me, we'd do it immediately because of the increase in safety to the jail, the inmates, the staff, all of that, and the stress, a little bit of stress taken off. But if you all turned around this month and said, hey, let's go ahead and make this effective immediately, I think Southern Health would need probably 30 or 60 days anyway to make it happen.
Yeah.
So it might not even be that big of a deal.
Well, your recommendation was July 1st, though, right? Is that what I'm reading?
Only because I thought it was easier for you all budget-wise. My personal recommendation, I think it would be best for everybody. The sooner we can get it in place, the better. We can hold off until July 1st, and I don't mind doing that, certainly, but the sooner the better for our facility and everybody in it.
Well,
Yes.
the reason I mentioned that too is because I know every year you usually have money left over.
Yeah.
I don't know if you guys looked at that. It looks like that'd be the case again if you just use that money.
I think we
That's
could.
just-
Yeah, the only place, like Chad mentioned, as far as I know, the only place we're going to be over that I'm looking at right now is that one line item of housing inmates in other counties.
And we're plowing fresh ground with that. And in my opinion, that we just have to, I know that he's strategically and trying to conservatively do that to keep our population at a point that's below 130 and trying to do that. I trust that 100%. And I think after we go through a year, we'll have a baseline benchmark that we can budget. You know, like when we go to budget, we'll have 9 months of data that we can try to get a better number next year on that. And I don't think it's, you know, like it's an outlier this year because we have tasked the process to try to keep our facility at below 130. That's a reality. That budget line's going to go up. Now, you know, back to David's comments. Like, I don't think there's very many people in the state of Kentucky that think, and let me say, public officials that think that turning over 100% control to DOC would be a good option at this point in the Commonwealth. But I will say again that I don't think that counties should bear the burden 100% of financially, physically, of incarceration of inmates. There's not one inmate in your facility that is there because they violated the Scott County Physical Court Ordinance 101. They are there because they have violated something of the Commonwealth's. And, you know, I hope that our leaders in Frankfort hear that counties need assistance in dealing with this, and they need more financial assistance, in my opinion. And I hope that that's something that comes our way. And you know, the DOC taking it all over, I don't think they have the manpower nor the wherewithal and desire to do that.
Right.
That's
right.
my 2 cents. Would you agree with that?
I would agree with that.
So,
yeah.
But I will go back. County should not bear 100% of the cost, and there's got to be some blended approach that helps give counties some relief. Mm-hmm. And you got 120 counties in the Commonwealth. Not every county can support or financially, run a local, detention center, and that's where the state could be creative and help by injecting funds. You know, like it's just a big challenge. So we'll see where it goes, and hope that they get input from local entities before they make some big decision that would impact all of us.
I agree.
So
Yep,
thank you for your time.
Yeah, I appreciate you all. Thank you.
All right. With that said, we will move now. Salary cap discussion, and I've shared 2 summaries. Salary cap summary essentially with the county clerk's office. 23 was 1.560. Essentially, after meeting with Kenna and Michelle, back at 1.560, looks at a number that will adequately cover the clerk's office. And I want to remind everybody that the salary cap is a number that we set by statute. It's required by statute that has to be submitted to DLG, and that is a number that that entity will not exceed for wages and benefits for personnel. It's a number. When we set this budget, that's the operating allocation. And that I just wanted to remind everybody of that. And then,
and it's dumb that you set that budget off fiscal year.
Yeah, and the salary cap is January 1 to December 31st. I don't understand why we still do this, but it's required, so we shall do it. So we've got that as a summary, any questions about the clerk's office? And then we'll move over to the sheriff's office. And, you know, there's a significant difference from our salary cap that we set for 23 of 4.89 to where what we're estimating to be 5.760. And I started digging, Michelle started digging, Betson's here and he can speak to it, but we met with Tony and Jeremy Nettles, and in last year, from our records, we had 41 deputies. Those 41 deputies included 3 full-time SROs. Been there for some time. Looking at our spreadsheet and projections for next year, that number goes up to 48. And that includes those, really what we have now is 2 full-time SROs and 1 DARE officer. So because that one of those full-time SROs transitioned to a grant-funded full-time DARE officer. But we have to reflect that salary. So that's a change that you need to have in your head. The other is, and this is, you know, last spring we brought this to the budget committee and had the conversation with the mayor and superintendent about funding contract SROs. Last year in our salary cap, we didn't have any contract SROs. In our budget, we budgeted contract SROs, so that's a difference as well. We have 4 contract SROs. Those SROs, in my opinion, what we have, let me find my spreadsheet here. You know, we've got 2 at Scott County High School, and I don't really want to go by the facility, but we've got high schools, middle schools, and elementaries covered. And, you know, I don't anticipate, and I'd ask you, we've got, as of January 8th, we'll have 4 SROs. That does not that 4 contract SROs, that does not cover DARE. So DARE's really 5. And that DARE officer operates out of one particular elementary, but comes and goes. So I don't anticipate any additional requests. Do you? I don't. So that's what I'm trying to get at is that's a number that I feel comfortable with. And then one additional, one additional thing that we included is right now you have 4 slots at the academy for new trainees, and you have to get on the schedule like months ahead of time, because if you don't get in. So you have 4 slots of new deputies. You've got 3 of them hired, correct? Or 3 of them slotted.
4 are slotted. But
4.
They won't start till March, and they won't go to the academy until I think mid-April.
So my understanding from counting the numbers, 3 of those 4 are existing positions.
Yes.
And 1 is new. And Kara's shaking her head, and she watches the spreadsheet closer than all of us. So 1 of those are new. So I'm trying to explain to you all why that number went up. When we start beating on the budget in February, March, but what we have is a number of 5.760 as an estimate of what you need to consider. And then there's also another a new thing is that in last year's we didn't have a chief deputy salary that we do have in projected in this new one as well. So questions or comments?
Are those 4, are they hired and ready to go into the program?
So they'll start in March. They can't start.
If you already have the candidates.
They're selected. Yes.
Is this for the academy?
This is for the academy. New hires completely up there.
I have a question. So we have 4 contract SROs plus 3 of our own for 7 total, give or take.
Yes, we have 3 full-time, and really 2 of them are full-time SROs.
One's
One of
DARE.
them's a DARE
And then
grant-covered position.
Force contract.
And
So,
a force contract,
the school-
185
The
days.
school system's covering half of those, however we split that up. Is that reflected in here?
The school system will cover half of all the 185s and will cover half of the full-time from including August all the way through May.
185 there.
Yeah.
too, basically.
So
Yes, that number is reflected getting reimbursed.
Okay. That was my question.
So question on SROs, like stamping ground, I think Don said he tried to get a hold of you. He's wanting to know about that in stamping ground, because we don't have a, he's doing it in stamping ground, I guess him and John are. So he was asking about, is there funding that's supposed to come back to the city?
That's that room, yeah.
Because he said they haven't received anything, so.
He hadn't tried to get hold of me.
So-
All the time, you
You have to bill it to get reimbursed.
You have to
You
bill
gotta
it.
bill it.
Talking to Betson earlier.
I say they haven't billed us. is what
I think that's what's going on. I don't think he understands the whole thing,
The
so
city of Stephenville will need to send a monthly bill to Gina Amos
Yeah.
at 4 days.
I'll come get that number from you.
I'll get with him. I'll get with them. Or who's their,
Don's the chief, so
I know, but who's their,
I think.
finance?
Oh, Rita,
That's
city
who I
clerk.
need to get with.
Yeah.
just have Rita send an invoice to Gina Amos and then go from there.
I told him I'd ask and see how we're
Yeah.
supposed to do it, so.
Yeah, we met about that months ago. Agreed to all.
So, this number is a number that we need to consider. But when we start hammering on that budget, that, they are requesting 1 additional deputy. They haven't slotted. We'll need justification, like we got more calls, we have X, we have this, whatever it is. The budget committee will consider that and we'll navigate through it. Now, the truth is, if you look at last year's spreadsheet compared to this year's spreadsheet, there's turnover. It happens. EMS, there's turnover. And there's always gaps when we're not fully staffed that it's very difficult to reflect that out and predict it out, but it's just reality. And then anybody that would like to make any comment about this, I would invite in value. Michelle, you had your hand up a minute ago. You can't back out. But hold up now. You had your hand up a minute ago.
Adding another SRO in January.
Well, but that's reflected in my 4. January 8th. January 8th, that SRO will go online, but it's January 8th. But that 4 number is in that number. So, any other questions?
The state has required this. I would request that you reach out to your state legislator and hammer them for the funding to the schools so that they are able to pay for it.
Essentially, they created an unfunded mandate, and it would be fantastic. I don't care if it's just, we're going to give you $5,000 per SRO or something. Something.
Shh, don't shoot low, shoot high.
I know.
Then negotiate down.
If there's no other questions, then I'm going to turn it over to Chris Runyon, and I've shared the narrative about the request to convert a part-time billing specialist to a full-time billing specialist, and there's really 2 buckets of money that are being impacted according to your narrative, and I'll turn it over to you to share
Judge,
specifics.
Magistrates. So I'd just like to have some discussions for you guys to consider to allow us to transition Johnny Jones from part-time to full-time. So he's at 24 hours a week now. He would go to 35 hours a week. Judge said he shared with you kind of the reasoning why. So just hit on it briefly to throw some numbers at you. We had 8,800 and change calls last year, which is up about 4,000 higher than we had, or 100 than we had the previous year.
How many more?
We were at 83 and change last year. We were 88 and change this
So
year.
about 500 more.
Yeah, about 500 more calls. So and that's been a steady for the past 2 or 3 years. We're just continuing
And it's
to
not
get
going to
busier.
stop. It's not going
No,
to stop.
It's not. Of those 8,800, 3,753 were non-emergent transports. So what has happened now recently, the big changes in EMS, are the insurance companies are requiring EMS agencies to get pre-authorizations, much like if you were having a procedure done in the hospital. They have to call your insurance company and say, are you going to pay for that procedure? So they're requiring us to do that now on transports. Otherwise, we just do it and don't get paid. We get no reimbursement if we don't obtain that prior auth first. So that's a whole new workload that's been put on us to obtain pre-authorizations. We have to justify or give our justification for the transfer and fax that into the insurance company who reviews it and then comes back and says yes or no.
That's only for a scheduled call, though, right? Like if the hospital has somebody they want transferred out and they call 911 or dispatch,
Right.
that's a non-scheduled.
If it's non-emergent, we still have to get the pre-op. If it's a priority emergent run, like a STEMI or something, yeah, that we don't. But if it's coming out of the hospital, going home, we have to get a pre-op on that. So it's just a tremendous amount of work that's been put on us.
I had no idea you did that many of those.
Right. Yeah, it's a big part of our workload. And it's only going to get busier. You guys have probably heard that there's potentially a new hospital coming to town. So that's,
Certificate of need request on that and is.
I haven't heard the final
middle
ruling,
of
but
February.
I feel like it's probably a done deal.
Do you think you all are busy enough, though, to run like a BLS only truck for those?
Absolutely, yeah, absolutely. And we've talked about that. And
Which would save the county some money, too.
What's that stand?
What's that stand for?
No, I'm professionals using acronyms. And I'm like, I don't.
Yeah, I'm going to make the DBQ of the 423 of the barbecue of the.
Basic life support. It's
So
just the
basically,
EMT
they
truck.
run
Basic
all
life.
ALS. So
He
they all,
didn't tell us what it was, which means he doesn't really know.
no, I did.
Right, we just
I
throw
did.
letters out.
So like he runs all ALS, which means every truck has a paramedic on it. Correct. You can run BLS, which is basic, which is 2 EMTs, which is what a lot of agencies do for somebody at the hospital who just needs to go home, right? They don't need a paramedic, and it's cheaper for the county, and it's really what I don't want to say EMT is designed for, but it's right up their alley. They can do that. It
But
takes
if you went that way,
You'd still have to have another truck and two.
what I'm asking is, could the buggy be a little bit less than a $385,000 buggy?
We looked at one yesterday, a demo stopped by, and it was $4.25.
Lord,
It's almost double what we paid the last time we bought a new one.
I was wanting to go in other directions.
Was it a Freightliner? What was
No,
it?
it was just a red.
Yeah,
running
I
out.
wanna go
Like
like
a Dodge
Ford?
chassis. It was
The
a
return rate
I was
on your
going
money,
to donate my.
you couldn't be in the black because of the equipment expense and the payroll. I mean, it would offset the expense and the use of our other ambulances. If you had one like solely for transportation,
Oh, I see what you're
the
saying.
money
yeah.
wouldn't. You know what I'm saying?
Yeah, and we would have to probably just do the 6th truck as BLS and not add the 7th,
Yeah.
and just
Can you
have
do a
them.
cost benefit analysis on that? Let the budget committee look at it.
Sure, absolutely.
Because especially if you put that BLS truck there at the Jacobs Way, right across from the hospital.
Right.
I mean, we're throwing crazy stuff out here, but I'm not,
Right.
but could be a cost savings, and then it would also free up a paramedic to cover other shifts that are needed. So
Yeah, we've had those discussions, so we'll, for sure, David, we'll get that together, present it to the budget committee. But just to circle back and throw a dollar figure out there, on these 3,753 calls, we put a $350 price tag on those because typically they don't pay a lot. Medicare, Medicaid has a certain amount, and it doesn't matter what you do, that's what they're going to pay. Now, they are, through that ground survey that we just submitted, looking at increasing their rates, but, I mean, who knows? I don't think the government's going to do anything that's going to cost them more money. But that figure is $1.3 million if we're talking dollars. So a significant part of our revenue comes from that. And the other piece of the picture is the car wrecks that we run. We've had about 535 of those this year. There is a predetermined set of money in that pool.
In 23?
Mhm.
Okay.
Yeah.
530 since July 1 or since
January 1.
January.
Calendar
All right.
year, yeah. And so when that money is is expired, it's gone. There's no, so if we submit our bill after the hospital, which typically will deplete that fund pretty quickly, we don't get anything. So it's really important for us to turn around quickly and get those bills submitted. So we pull those out, process them, get them QA'd, submit to the billing company, and that's about $500,000 we're looking at there.
Can those bills be submitted to, now you're talking about submitting bills to the insurance companies, correct? Okay.
Well, we submit to our billing company who processes them,
To
submits
the
them.
auto
Yeah, we use A and B.
Okay.
Yeah, and then, yeah. But there's a little bit of tracking down too, because typically they don't have the car insurance on the scene. We can't wait long enough to get that. So Johnny currently now follows up with whoever the law enforcement agency was to get that information for us. So it's a pretty valuable position, and it's only getting more.
Sounds like it can pay for itself.
Absolutely. Easy, yeah. Yeah.
Questions? So we'll bring this back on Friday for consideration.
Okay.
And appreciate the diligence to try to keep us in one direction.
Thank you.
Our last topic, but not least, is kind of a recap from Jeff about the consideration of updating data and doing some data review on our market medians.
Yeah.
And I'm just going to let Jeff kind of walk through a timeline and then talk a little bit about opportunities.
Sure. Thank you, Judge, and to court. And I wanted to start off with just kind of going a recap of what we've done over the last 4.5, 5 years. But I think what's most important is just to talk very briefly about the fact that the judge and the court made this a priority, and really, I guess, 17, 18, and really didn't come to fruition until 2019. And if we wouldn't have done the work we did, I couldn't imagine where we'd be right now if not for the events of the pandemic and inflationary pressures. If we wouldn't have been on the ahead of the game there, I think we'd have been even further behind right now. So I think the judge and the court deserves a lot of credit for that. So to kind of recap things, I mean, as you know, in the summer and fall of 2019 is when we started studying data and getting information from different data sets. We used, as you know, the Kentucky League of Cities data, which was in existence, the KY Stats, which pulled its data from the Bureau of Labor Statistics. We used KCO data, which I helped them get a salary survey started, and, of course, the Georgetown City data. And when we did set up that structure, it was to run a range of 85% to 100% of the market median. As you know, the people who were in that 0 to 5 years were at 85%. If you were in the 5 to 10, you were at 90%. 10 to 15, it was 95%. And then on 15 years plus, you were at 100% of the market median. That was the structure we had. All those changes were put in place in November of 2019. So that was when we had our first big step in the salary study. Then in the spring of 2021, we updated the market medians for all those positions, and we also adjusted our compensation structure from 85 to 100% of the median to 90 to 105%, if you recall that. In addition, in that period, because of the people who worked during the pandemic, we offered that pandemic payment in June of 2021, that $1,500. So it was another positive thing we did. Also, in the winter and spring of just this past 2023, we looked at a few positions to make sure that they were consistent with the market. And we looked at positions like paramedic, EMT, firefighter, deputy jailer, and deputy sheriff. So we looked at those positions, and we found that we needed to make adjustments with some of the uniformed officers in the jail and in the sheriff's office. So we made those adjustments. In addition, we added on some additional tiers. We added on tiers at 2.5 years, 7.5 years, and 12.5 years. So those have all been very important adjustments. And really one area where it was most important was at that bump where you were here 2.5 years, because the median length of employment here is just a little bit less than 5 years. So that is just another reason, another thing a person has to give up if they go someplace else, is now they've gotten a pay bump at the 2.5, and so that's helped us with retention. So all those adjustments went into effect here just this last July 2023. And so it's very obvious that
and it should, for anybody that's listening, for any employee that's here, I mean, compensation has been an important issue. It's something we've paid attention to for 5 years now on an ongoing basis. So I think we all deserve a lot of credit for that.
I would say it's been a priority.
Yeah.
Along with benefits.
Oh, yes.
Absolutely. So it's not to be taken for granted. So given our efforts over the last 5 years and with the cost of living adjustments we provided over the last 5 years, I really do believe that we should be fairly close to the market. Now, the only thing that might have an impact on us is that I'm part of some listservs with all other HR public agencies in the state. There's been a lot of people have been doing catch up, and doing their own compensation studies and trying to get things updated for there. So there could be some ratcheting. There could be that maybe we've slipped a little bit behind, possibly. But I really feel like that for most positions we're going to be in a good position. But I guess what's important is that it's been 3 years since our last comprehensive compensation review, and so I think the timing might be right for us to take a close look at that. And, the kind of way I look at this, it's a pulse check. It's preventive maintenance. It's us just being proactive, being wise, in trying to stay ahead of the game here and making sure we don't slip behind and get back to where now instead of maybe having to make a 1% adjustment, now we're back to having to look at a 3 and 4% adjustment to catch back up with the market. So that's all I'm encouraging. And that's assuming that if that's even the case. So that's what I want to put in front of you. So at this time, I think it'd be best for us to consider engaging a third-party consultant to help with doing a data review, a data refresh. I think what they could probably look at is about 35 of our 70 positions, and then we could benchmark the others against the ones that we do review. I do know that the city of Georgetown has chosen to use the management advisory group from Virginia as a consultant for their compensation study, which they're embarking on right now. The MAG group recently completed a compensation study for Lexington and Louisville. We held a preliminary call with them before the holidays, and they appear to be a competent and capable group to handle such a project. The fee that Russell Campbell has posed to us is a fee of $17,500 for the compensation study if we choose to go in that direction. I guess one thing that's good is that having that data will permit us to make informed decisions to invest funds wisely if we find that they need to be invested. And if any adjustments need to be made, they can be built into the 24-25 budget because, the hopes is that we would get the data, of course, before the budget planning cycle comes into play. Also, using the same consultant will permit the county to utilize the same data set as the city, and I think that's important. Given the expected future growth, our goal would be to position both entities so that we are the public employers of choice in the region. My goal here is not to compete with Georgetown. My goal is to compete with Madison County and Richmond and Versailles and Woodford County and make us be the employer of choice in the region. That's what I'm hoping that we can do, is position ourselves that way. And I guess the last thing is that ensuring people are provided with a competitive wage and benefits, that's the foundation. That's the base for us. There's a lot of, as you all know, and you have your own work experiences, that the money you make and the benefits you earn it's one thing, but there are so many other intangible elements that are important in a work situation. But what it does is allows us to at least take care of that issue, and then to focus on the more deeper recruitment and retention issues that we have at play here. So I'll stop there and
Yeah, my question was going to be, did you look back to see what we paid last time for a salary survey? Because I believe it was 26, 21. It was more than this. Yes.
Yeah.
It was more than this.
Well,
and we're not going to discuss who did it, but publicly. But I was extremely disappointed because it was the same data that you pulled in 19 that is publicly accessible. That I thought that there would be a deeper dive into what we were provided. So
yeah, we're looking at having them pull from comparators, like working and deciding what cities and counties would use as comparators, a similar size, similar geographic challenges. Even if they're not even in the state, I think that one thing I mentioned previously is that you could even look at the cities and counties around like Knoxville. I mean, they would probably face the same pressures as we do being close to Lexington.
Tennessee, their cost of living is much higher than ours.
So, but anyhow, I mean, but when you get a large enough, when the law of large numbers comes into play, when you get enough numbers in your data set, it kind of washes out.
So do you know if Georgetown has the list of comparators that they're going to be using?
Not at this time, we don't.
I think this coming week, I think their consultant's doing a site visit, and I don't think that's been set yet.
Could you ask, like you said, they've recently done Lexington, right? Could you ask Lexington, like, were they happy with what they got? Not the results, but with the data set.
The service.
With the
Absolutely.
service. And
yeah, absolutely. And I have not done that yet.
To maybe ease David's mind and everybody else is up here,
Well, I just want to make sure that they use appropriate data. Because, I mean, if...
Well, and one thing
because Lexington's an anomaly because they're so big. You really, at that point, you're comparing Bowling Green and Louisville and...
I'm not worried about the results, just
Chattanooga.
Are they okay with their data, the data set that they got?
Yeah, and what I think needs to happen is not only should it be some cities and counties of the same size, but I think they should also try to incorporate some larger data sets into it as well. Like, there's no reason why you couldn't use the data from KY Stat still, which pulls their data from the Bureau of Labor Statistics. I think when you pull in larger data sets, you're probably going to get a more valid number, I think. And then there's also the Economic Research Institute, which also gathers salary data. Now, I'm not saying, the salary.com stuff, I think that's fraught with problems, if you ask me. But,
right.
Because it's self-reported, it's employee reported typically, and how they develop their data. I don't know that I would trust that as much as somebody actually pulling data from an organization where the HR director or somebody is then putting that data into the system, so then you know that it's much more valid.
Questions, comments?
I suggest you do it every 2 or 3 years.
Well, now,
think of it in the last, how many things have happened in the last 2 years to put pressure on wages?
Yeah.
Hiring, at least in a year, or the last 5 years.
I think it's money well spent. And what I would hope is that if we go ahead and do a comprehensive study, I would hope that it'd be the last time we have to do one for maybe 3 years. So maybe every 3 years, like you're saying, you just kind of do a check of the market, and I think it's a wise move.
What's their time frame on completing a study?
I'm hearing that they'll have data by mid-February, which seems incredibly ambitious.
So really forward, okay.
So it's possible that we would have data to make decisions with well before.
But I'd say that it's going to be a lot of the same data that Georgetown uses.
Yeah, and I would like it there be some consistency between the two. I mean, a firefighter's a firefighter. All these positions, an admin assistant here is an admin assistant there.
There is a county in the city.
Yeah, John just got Chief Ward just got up and walked out, and then you said that.
Yeah. So,
I think you plan to have some discussions with the consultant, and we can follow up after those conversations and consider something next Friday if that's the pleasure of the court.
I think it's a great idea, and I think with the job that you did internally in 19, if you're comfortable with what they're doing, then I think the cost, and it's considered a professional service, correct?
Yes.
Okay.
Any other questions or comments? With that said, that covers what we intended, or what I intended. If the court has anything else, or if any of our staff here or audience has anything, JR sharpened the plows and salt spreaders, and you won't sleep tonight, will you? That's just the nature in it. So we'll see what weather brings us. So we appreciate the road department being ever ready.
I have one brief thing.
Yes, sir.
I think Captain Nettles got confused with this week, next week for LAPP grant, but Rob had talked to me earlier about mentioning something about gun safety after some recent incidents we've had in the county, just about making sure people are locking things up, keeping things out of reach of children.
Just wanted to get up here and say something about that
No,
after
it's,
talking with him. I think it's
reality
very
and-
important that people make sure things aren't accessible to juveniles that have no idea what their actual function is or capabilities.
Agree 100%.
Do you have an update on, thank you, Officer Benson. Do you have an update for us on bluegrass water? The last email we got was on December 8th.
Yeah.
And it said something along the commission, and Cam, you can chime in if you want, to enter order regarding bluegrass water's order to implement rates, but there was going to be some type of.
I mean, I think, Chad, we're still waiting on a big order from that hearing that happened several months ago. We can follow up back,
With
get your question
Randy.
to our attorney and see if he can give us anything. I think we're just in a holding pattern.
But we'll see if we can we send an email
we
and
sent
ask him
email
for an
to David
update.
Spinard and Randy
We'll
Stilwell
share.
yeah.
Anything else? With that said then, and we will adjourn this work session and thought it was very productive. Thank you all.
Yeah, I seen that email.
Okay.
I just wanted to